Individualizing the treatment of Hodgkin lymphoma likely is the future of treating this disease, because we know that the patients are very heterogeneous in terms of their age, comorbidities, but also in terms of tumor composition. And we need to address this heterogeneity by individualizing treatment approaches that take into account the goals of treatment, as I said, biologic composition of the tumor, and also age and comorbidities. And to this end, we are in the lucky position that we have multiple novel drugs that provide a targeted treatment option for these patients. And what we now have to do is to integrate these targeted drugs with our understanding of the disease, and then in the end provide individualized treatment approaches for these patients. In the first line setting, this means reducing the exposure to conventional chemo and radiotherapy by having a rational, biologically informed treatment that is ideally guided by on-treatment response assessments. And in the relapse setting, this could also mean that we try to address the failure of anti-PD-1 blockade by looking into disease biology at the time of failure, and then identify potential escape mechanisms, which could be upregulation of alternative checkpoints, and target these escape mechanisms by adding the respective antibodies or drugs to tackle those pathways. And by doing so, I think we are in the lucky position that we can really develop smart treatments for our patients that ultimately aim at cure, or in the setting of multiple relapse disease or frail older patients, at least at very prolonged progression-free survival at a good quality of life. And this is one of the main goals of our study group and also of other investigators in the field. And this is why I think, these are exciting times, and we are very much looking forward to moving forward with individualized treatment of Hodgkin lymphoma.